Welcome, I'm Dr. Eli Sluch, and today we're going to be talking about cataract surgery.
In order to understand cataracts, we must first understand how the eye works. The eye works like a camera, where the cornea and the lens focus the light on the back of the eye, the retina, which then sends the signal to the brain using the optic nerve, and we can see images. The lens needs to be clear for the system to work properly so it can allow for the transmission of light to the back of the eye. When we're young, the lens is clear and is able to do that. So with a clear lens, we have the light traveling from the object through the clear lens and making a clear image. As we get older, the lens becomes more cloudy, thereby causing blurriness of the image and causing a decrease in the vision. The only way to treat this is with cataract surgery. With cataract surgery, we remove the old cloudy natural lens and replace it with a new clear plastic lens. The new plastic lens is now able to transmit the light from the object to the back of the eye in a clear fashion. So now, when we look at something, the light travels through it and the image is clear once again.
Patients often ask me, when should I have my cataracts removed? And I usually recommend you have cataract surgery when two criteria are met. Number 1, the cataract is causing your vision to be blurry. Number 2, this blurry vision affects your activities of daily living, such as reading or driving. There's usually no urgency to have cataract surgery. However, it is important to know that as the cataract grows, it becomes more dense. If it becomes very dense, this does increase risk of complications during surgical removal.
Let's talk about the surgery itself. Cataract surgery is a short 10 to 15 minute procedure done on an outpatient basis. This means after surgery is done, you'll be going home in about 30 minutes. It's done under local anesthesia, where we will put some drops in your eye to numb it up so you don't have any pain, but we will not be putting you to sleep. You will have an IV going to give you some relaxing medication during the procedure itself. You'll be lying flat on your back and we'll put a drape over your face. The surgery starts by making small incisions into the eye itself that self-seal and does not require sutures. We go in with an instrument and make an incision in front of the cataract. Once that's completed, we use an ultrasound vacuum probe to remove the actual cataract from the eye in pieces until the entire cataract is removed. At this point, the eye is ready for the new lens, and the new lens is injected into the eye in a folded fashion like a taco, and then the lens will open up within the eye to fill up the capsule or bag and stay in that place. This surgery is permanent. The cataracts do not grow back, and the lens should not move once it is complete.
Let's take a few minutes to talk about risks of cataract surgery. Cataract surgery has been around for many years and has an excellent safety profile. However, as with any surgery, there is a small set of risks associated with it. The most common risks include worsening dry eye, where they need to wear glasses afterwards. Rare complications include retinal detachments, tears or holes, which will require more surgery, swelling of the cornea or the retina, which usually resolves on its own after a few months of eye drops, the inability to remove the entire lens or to place a new lens in the eye at the time of surgery, requiring more surgery. Some people get persistent inflammation or glare afterwards, which usually resolves on its own after a few months. In very rare cases, you may get an infection in the eye, which will require injections. In extreme cases, you may lose vision or lose the eye. If you're at an increased risk for any of the above complications, I will let you know during your consultation visit. You may have heard from your friends or read on the internet about different types of lenses that can be placed in the eye at the time of cataract surgery. Let's take a few moments to put everything into perspective. This will best help match your options with your post-surgical expectations and goals. Option number 1 is the basic cataract surgery. In this option, the cataract is removed and a new lens is placed in the eye. But this does not correct for astigmatism. Therefore, most people still require glasses afterwards for best vision. This is a good option and is covered by your insurance minus your deductible. Option number 2 is the cataract surgery with toric lens placement for astigmatism reduction. What is astigmatism? An ideal eyeball is basketball shaped, but many eyeballs are actually football shaped. This causes blurriness in your vision even with cataract surgery. But at the time of cataract surgery, we can place a special toric lens to help make the eye more spherical. This reduces your dependence on glasses for distance by about 90%. This is a great option for somebody who wants to have good distance vision without glasses, but is okay to wear glasses for up close. Option number 3 is cataract surgery with multifocal lens placement for reduction of astigmatism and presbyopia. What is presbyopia? When we were young, our lens was elastic and was able to focus far away and up close. But as we got older, it became more rigid, so now we have to wear reading glasses or bifocals. Fortunately, over the past 10-15 years, a new technology has come out that's able to give some of that vision back. The multifocal lens is able to focus light simultaneously from far away and up close to give us the most range in vision. This is the best option for somebody who wants to really reduce their dependence on glasses after cataract surgery using the latest technology. The multifocal lens is not for everybody. People with macular degeneration, advanced glaucoma, severe dry eye, and many other eye conditions are not candidates. The multifocal lens is not perfect. Some people experience worsening glare afterwards compared to a traditional lens, and a few people may still require glasses to see fine detail. If you're interested in a multifocal lens system, we will discuss it during your consultation visit.